On this Friday night, a new tool in the fight against COVID-19. A new COVID-19 notification app is ready for download. What will it do, and will enough Canadians get it?
I would be comfortable downloading this myself. They're not collecting any personal information, no geolocation data, nothing.
Taking the temperature of Canada's economic health. There are signs the economy is on the mend. What will it take to fully recover? Plus, a crisis within the crisis for American healthcare workers.
I went through food donation, food drive lines. Grocery money was tight.
Scores of frontline workers laid off as U.S. hospitals bleed cash during the pandemic. And a race against time off the BC coast.
Nice roll.
Rescuers fight to free 3 entangled humpback whales.
Global National with Dawna Friesen.
Good evening and thanks for joining us. It was promised long ago, and Prime Minister Justin Trudeau chose today to announce the rollout of an app designed to alert people if they've been in contact with someone who has tested positive for COVID-19. It's only available in Ontario for now, and the government says it is not a contact tracing app. It's called an exposure notification app.
Health experts say that if enough people sign up, this app can help prevent future outbreaks of COVID-19 in Canada.
Abigail Bimman explains how the app is supposed to work and how the government is reassuring Canadians their privacy will be protected.
Did you know that your smartphone can help limit the spread of COVID-19?
It's called COVID Alert. It runs on Bluetooth, exchanging codes with other phones, and the government promises location and personal data won't be tracked.
It doesn't collect your name, your address, your geolocation, or any other personal information. I've downloaded the app this morning.
Canada's Privacy Commissioner says he'll use the app too. In a joint statement, he and Ontario's Commissioner say they support the app, but there must be ongoing monitoring. And they warn there is still a risk third parties could try to make users disclose information, including exposures.
I don't put a lot of merit into that because the information that is retained is only retained for 15 days. It's not identifiable.
Anne Kavukian is a former 3-term privacy commissioner. Apple in the province of Ontario asked her to weigh in before rollout.
Believe it or not, because I'm usually so critical of everything, this is an amazing app.
So what this is balancing is the public health benefit versus our privacy implications. So it is not maximizing the potential public health benefit.
Richard Latchman says it's a good balance, but it needs a lot of uptake to be a success.
There was a study by Oxford University where, in their estimate, it needs to be 60% of smartphone owners in a country need to download it to get the maximum benefit. In some of the countries where this has been tried, we're nowhere near those numbers.
The government wouldn't say what the download goal is, but stresses it's not a replacement for contact tracing.
Contact tracing will still need to be done right now by local public health departments.
Officials are asking people everywhere to download it now, but only in Ontario will you get a one-time key you can enter in the app if you test positive for COVID-19.
Abigail, back to questions about the WE charity. The Prime Minister testified yesterday he gave no preferential treatment to WE, which we know has close ties to his family. And he said he pushed back when he first heard WE was being considered for the contract to run that student grant program. So due diligence could be done, yet the contract was awarded and he's being investigated for breaking conflict of interest rules. So what due diligence is he talking about?
Well, Dawna, Trudeau was asked about that several times today, and he was clear the due diligence he asked for was to make sure WE was the only organization that could deliver the program. But he didn't explain why he felt confident enough to sit at the cabinet table after that briefing in terms of a perception of a conflict of interest, an ethics issue separate from the program itself. Trudeau also seemed frustrated to be questioned about WE in the first place. Listen carefully to this answer.
Challenges that have followed for the WE organization, and indeed the questions that have been asked of this government have been disappointing because it gets in the way of the help that we've focused on doing for young people.
But the opposition continues to push this issue. There's a new call for documents and information about what conversations the Prime Minister's office had with WE as 2 committees keep investigating. Dawna?
All right, Abigail Bimman in Ottawa, thanks. The Prime Minister made several other pandemic-related announcements today, including nearly $59 million to help temporary foreign workers on Canadian farms. Advocates have been calling for greater health and safety measures after repeated outbreaks of COVID-19 among temporary foreign workers. More than 1,000 in Canada have tested positive for COVID-19, and 3 are known to have died from it.
This will fund more farm inspections, provide emergency relief when needed, and improve the overall living conditions on farms.
The Prime Minister also says the temporary foreign worker program will be reviewed to find ways to improve it. There is news today, too, about what happens after the Canada Emergency Response Benefit, or CERB, ends this fall. More than 8 million Canadians who lost their jobs or were unable to find work because of the pandemic have applied for the $2,000 a month payment. The Prime Minister says people relying on it will transition to employment insurance benefits this fall. And he says a traditional parallel benefit will be available for people who don't qualify for EI, such as contract and gig workers. It will include access to training and the ability to work more hours without a steep clawback in benefit payments. The Prime Minister also says there will be a sickness and caregivers benefit for people who get COVID-19 and don't have sick leave, or if a family member gets sick and needs care. Ottawa is also extending the Canada Emergency Commercial Rent Assistance until the end of August. It's the rent subsidy program thousands of small businesses are relying on. Well, plenty of people are still out of work, but the Canadian economy is beginning to heal from the damage caused by the pandemic. Stats Canada says the gross domestic product grew by more than 4% in May as businesses began to reopen. That's far better than most economists predicted, though, as Eric Sorensen explains, the economy is a long way from even close to normal.
After the near total shutdown last spring, the economy has begun accelerating again. Construction up almost 18% in May. Retail sales were up 16%, the biggest monthly expansion for both industries in decades. In ordinary times, that would be astounding, but in 2020, it's a modest bounce back. The overall Canadian economy, up 4.5% in May, was better than economists expected, but that's a staggering 15% below what it was in February before the pandemic hit.
Even with the recovery in May and a further rebound in the numbers in June, it seems like we're still a far way off from where we'd like to see the economy tracking.
Much of the economy is like that. Better, but not where it once was.
We're super glad that we can get back up and running.
Sydney Lunny says the green eggplant is enjoying a sharp rise in business with expanded patios, but even as dining inside opens up, with distancing they can only serve half the customers they did before.
It's really frustrating as to that we can't see the amount of customers inside the restaurant as we could before, because we are trying so hard to practice all of the safety protocols.
While some businesses mount a comeback, others have shuttered. David's Teas is closing most of its stores across the country.
You're seeing bankruptcies. Why is that? Well, it's because underlying demand is weak. Or in other words, people simply aren't spending as much money as they were before.
While the economy has picked up, some businesses are far from normal and will not get back to normal for months or even years. Air Canada is reporting a $1.75 billion loss in the second quarter. Passenger numbers down 96% from a year ago. Inside Canada's Atlantic bubble, one premier hopes to open up to more travel.
It's not just people coming to this province to come to visit and see the beautiful places. They're coming actually to do transactions. So we have to get to the point where we're going to be living with COVID, and we can't continue to lock ourselves down.
Economists say the key to economic growth is keeping virus case numbers low, so Canadians will feel comfortable traveling and just going out to spend their money. Eric Sorensen, Global News, Toronto.
Just ahead of the long weekend, some public health restrictions in Toronto and the Peel region have been lifted. Those regions join most of the rest of Ontario in Stage 3 of that province's reopening plan. It means gyms and movie theatres and playgrounds can reopen. People can dine inside bars and restaurants, not just outside on the patios. Indoor gatherings of up to 50 people are now allowed, and outdoor gatherings of up to 100. Ontario's premier warns the province is not out of the woods, though, and people need to remain vigilant.
A month ago, our neighbors in the U.S. were heading into the July 4th long weekend. The numbers were down, schools were set to open in 4 to 6 weeks. Bars and restaurants were reopening. That long weekend, People went to parties, beaches, and gatherings, acting like COVID-19 was over. You just have to look at what happened since then to know how devastating it has been.
Windsor, Essex is now the only part of Ontario that remains in stage 2 of the reopening. It continues to have the highest rate of COVID-19 in Ontario. Nova Scotia reported 2 new COVID-19 cases today, its first new infections in over 2 weeks. A new requirement to wear masks in most indoor public spaces comes into effect today, though the province is taking an honours system approach to that policy. And New Brunswick is expanding its bubble a little bit. Ross Lord has an update on the COVID-19 health measures in Atlantic Canada.
At this fitness center in Dartmouth, Nova Scotia, customers don't get in unless they wear a mask.
You have to wear the face mask as soon as you enter the building, in any public spaces, from the welcome desk to the hallways, to the locker rooms.
In a province where new COVID-19 cases have been scarce recently, making indoor masks mandatory could keep the virus away. People like Corenda Colley can still exercise without wearing a mask.
Wear it on the way in all the common areas. They said it's okay if you don't wear it while you're working out, but make sure to wear it in the common areas.
In neighboring New Brunswick, there are also new rules. That province is expanding the Atlantic bubble, allowing visits from a select number of communities in Quebec.
Not only are these only day passes, but you have to register in advance so we know where you are.
Back in Nova Scotia, the mandatory mask policy has plenty of supporters.
We don't know when there's going to be a second wave of COVID-19, and we have to cover ourselves, especially if you're a senior like me.
But the province has decided not to enforce the rule, so there's no penalty for breaking it.
I think there should be a fine. I think that's really the only thing that will work.
We shouldn't need to have a strong compliance and enforcement approach to have people do the right thing.
More adjustments as Canadians follow the moving target of pandemic rules. Ross Lord, Global News, Dartmouth, Nova Scotia.
There's still lots of hope riding on a vaccine, and today America's top infectious disease doctor said there are no guarantees, but he's cautiously optimistic one could be ready for distribution in the U.S. by the end of the year. Dr. Anthony Fauci appeared before a congressional subcommittee investigating the U.S. response to the pandemic. He also pushed back against claims based on one study that the anti-malarial drug hydroxychloroquine is effective against COVID-19.
The Henry Ford Hospital study that was published was a non-controlled retrospective cohort study that was confounded by a number of issues. So that study is a flawed study, and I think anyone who examines it carefully is that it is not a randomized placebo-controlled trial.
It says peer-reviewed.
It doesn't matter. You can peer review something that's a bad study.
Fauci says all the valid scientific data shows hydroxychloroquine is not effective in treating the virus. His comments come a day after President Donald Trump said he still thinks it works against COVID-19. In demand but out of work. Coming up, the unexpected impacts of this pandemic on American healthcare workers. Plus, an enormous task off BC's coast, the race to save 3 entangled humpback whales. In the U.S., healthcare workers are on the front lines of the worst outbreak of COVID-19 in the world. They're in demand more than ever, but in the midst of that, tens of thousands of nurses are being laid off. Private, for-profit hospitals are facing a dire financial crisis. As Jackson Prosco reports, it's an unprecedented challenge.
In the midst of a national health crisis, American healthcare workers face an unexpected problem: unemployment.
When this first came out, I was ready to put on my boots and go out into it.
Instead, nurse Dana James was shocked to see her hours cut. As the virus ravaged New York and New Jersey in March, the Florida hospital where she works sat empty, cleared out to make room for patients who never came. Soon after, she was laid off.
It doesn't bring me shame, but I went through food donation, food drive lines. I've loaded the kids up, and grocery money was tight.
By April, an estimated 1.5 million healthcare workers in the U.S. had lost their jobs. Hospitals canceled money-making elective surgeries to free up beds for COVID-19 patients. Emergency room visits dropped off as people stayed home. Like any other business, for-profit hospitals look to cut costs.
And a lot of hospitals are quiet about cutting nurses' hours, right? I mean, because who wants to say during a worldwide pandemic that you're cutting nurses' hours?
It's estimated American hospitals have lost a combined $50 billion per month, every month since March. That was just the first wave. And as the pandemic ramped up and as patients started showing up, the costs of treatment spiraled. Hospitals went from empty to overwhelmed, forced to buy PPE, ventilators, and extra beds.
Well, I think what we're seeing, particularly in the United States, is we're seeing a system of care that really doesn't act as a system. These are individual hospitals, individual doctors, individual insurance companies, and suppliers, all acting in their own best interests.
Jobs have been slow to return, even as cases of the virus surpass 4 million.
It's turned around somewhat, but it hasn't returned to pre-COVID levels.
Long term, there are fears the financial crisis gripping the health industry will lead to a labor shortage. Hospitals and clinics could be driven out of business.
Right now it's ugly. It's like nothing I've seen before.
Today, Dawna James is back on the job. In fact, she's busier than ever.
It kind of is an eye-opener to see how our country has dealt with this compared to other countries and how we're developing, comparing us to the rest of the world.
Her only worry now, treating patients who may never understand the toll the virus has taken on those providing care. Jackson Prosco, Global News, Washington.
Still ahead, a big change in Hong Kong's upcoming elections.
You're watching Global National.
Hong Kong has announced it's delaying its upcoming elections. They were scheduled to take place in September, but have been pushed back a year. Hong Kong's leader, Carrie Lam, says politics was not involved. She says it's been done to protect people's health. Hong Kong has had a surge in COVID-19 cases since the beginning of July. The election delay is a blow to the pro-democracy opposition that was hoping to capitalize on rising anti-Beijing sentiment. There's also been an increase in cases in parts of the UK, and the government has delayed plans to ease public health restrictions. Casinos, bowling alleys, and other venues were supposed to open tomorrow. That's not happening now. Wedding receptions and indoor concerts are also on hold again. The UK is expanding its mandatory face covering rule to include museums, cinemas, and places of worship. The measures will be reviewed again in 2 weeks. Next, the case for easing Canada's border restrictions for couples. Off the BC coast, rescuers are working hard to save 3 humpback whales tangled in fishing gear. This one was spotted near Vancouver Island. It has a trap and line running through its mouth. Trying to remove it takes caution and patience. Rescuers say the trap is very close to the whale's body and the gear will be difficult to cut off. 2 other humpbacks caught in lines and netting have also been spotted. The Department of Fisheries and Oceans says entanglements like this happen every year, but it's unusual to get so many at once. The border between the United States and Canada has been closed to non-essential travel now since March 21st, and no public health officers in this country want it to open anytime soon. That's left some couples separated longer than they ever expected. The travel exemptions only include partners who are married or common law. And as Mike Drolet reports, a Canadian doctor is petitioning to change that in the name of love.
Welcome to Canada? Not recently. The border remains closed, but to a select few. When that will change could come down to trust.
The challenges are people actually adhering to quarantine and those rules.
Epidemiologist Ashley Tweet ran the numbers. If the U.S. continues to have 75,000 new cases per day, 44 infected Americans would cross for every 25,000 travelers. Keep the border closed to non-essential traffic, and that number dips considerably. The bottom line is, if the U.S. can get below 10,000 new daily cases, the risk will be manageable. What she fears is the so-called super spreader, a single infectious person who can transmit the virus to dozens or even hundreds of other people.
So every case that we're importing has the potential to spark an outbreak. So that's where the concern lies.
And that's science. What's missing, says Dr. David Edward Uipoon, is the humanity. When his girlfriend Alexandria Aquino landed in Toronto from Ireland, she was turned away. The exemptions for travel don't include partners unless they're married or common law. Poon submitted a petition, not to have the border reopened, but to have the exemptions expanded.
We are willing to sign a sworn affidavit. We are willing to put ourselves legally and financially bound to that concept.
In response to a question from Global News, the federal government intimated it's happy with the exemptions as they stand. But NDP MP Brian Massey says that doesn't fly in 2020.
And we shouldn't just define it by basically a nuclear family example from the 1950s. What we need to do is be more modern about the approach here.
Modern, like the long-distance relationship between Floridian Gianna Formica and her Montreal boyfriend Jean-Christophe Blais. They've been together for a year and a half, but for all their dreams, their future is in the hands of politicians.
You know, I would take all those safety precautions, and they can knock on the door, they can check on me, I don't care. I just want to be with the person I love.
For that to happen, it seems science is going to have to make room for trust. Mike Drolet, Global News, Toronto.
And that is Global National for this Friday. I'm Dawna Friesen. We'd like to say Eid Mubarak to all of you celebrating Eid al-Adha. It's being celebrated differently this year by Muslims all over the world because of the pandemic. No more praying shoulder to shoulder. Hundreds of people were invited inside this stadium in Dublin, so they had enough room to maintain physical distance. In Illinois, these worshippers also kept their distance by praying in a parking lot. Thanks for watching. Take care of yourselves. Bye-bye.